Hearing loss is the third most common chronic healthcare condition in the United States, and exposure to loud noise is the main cause. So what is considered loud? Keeping in mind that the average conversation occurs between 60 and 70 decibels. Exposure to any sound 85 decibels and above is considered loud. That's about the sound of a vacuum cleaner. Duration's also a factor. The longer you're exposed to loud sounds, the greater chance of hearing damage. The hearing aid and audiology specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery explain that the sounds around us every day can have a lifelong impact on our hearing.
What we're finding is that younger people now need to come in for baseline hearing tests because we live in such a noisier environment that maybe our parents did. The music, just their jobs, there's just a lot more noise involved.
Some of the first symptoms of hearing loss would be ringing in the ears. Ringing in the ears, what we call tinnitus, is something that is a symptom of damage to the hearing nerve. So many people will come in and say, my ears are ringing, and one of the first things we will do is test the hearing because we want to determine, is there some damage or degeneration of the hearing nerve that can be associated with that ringing.
There are three types of hearing loss. There's nerve damage, which is called sensory neural hearing loss, and that's just where the little hair cells in your inner ear or the nerve is damaged. So there's nothing that can be done to fix that. We can aid it with a hearing aid, but we can't fix it. There's conductive hearing loss, which is something medically is going on in the middle ear that's not letting the signal pass through to get to the hearing nerve. So sometimes that can be treated medically, whether it's fluid or infection, or even if the bones of the middle ear are not working, there's surgeries that can be done to fix that. And then the third type is called mixed loss, and it just means that it's a mix of both the nerve damage and the conductive. So there's a component of that loss that might be fixed medically, but you're still going to have some hearing loss from the nerve damage.
Anytime someone is working around loud equipment, working in a factory, it is regulated now that people wear hearing protection, and it's monitored by OSHA. So a lot of people don't do that though, because they say, I can't hear my boss, I can't hear my coworkers, and so they sort of take their sound protection out, which can damage the hearing. So it's very important to wear hearing protection when you're working around loud equipment in a factory. A lot of people who are not in large companies, maybe they have a lawn company, a lawn service, and they're not monitored by OSHA, but they do need to be wearing earmuffs or earplugs to protect themselves from the loud equipment.
Here are some simple things you can do to protect your hearing from the harmful effects of loud noises. Walk away or turn down the volume. Wear hearing protection. Wear noise-canceling headphones instead of earbuds, and make sure hearing tests are part of your routine health screenings. For more information on the hearing aid and audiology services available at Lake Ear, Nose, Throat, and Facial Plastic Surgery, just click the Volume Control story link on our homepage at yourhometownhealth.com.